If you're thinking about having shoulder surgery, then this video is going to be great for you. It's actually a presentation that we did for about 50 people on the biomechanics of the shoulder, like how it actually works and how it gets frayed. So we're going to walk you through that in this presentation. We hope you like it. Shoulder surgery is terrible. A normal shoulder surgery, that when we have somebody come in for that, it's a 6-month rehab, and everybody that's had shoulder surgery, it's horrendous, right? Really painful. So we're going to talk about why that is. But what we found was that it was 56 when people got to 12 months. So after the age of 50, it's taken about 12 months for them to get better, like to get full resolution. But then we found another study that says people are at 56% improvement at 12 months, right? And then they just kind of stay stagnant there. So it's really getting to that surgery is not always a magic pill. Sometimes it's necessary, and we know where that line is, but it's not always a magic pill, and there's things that need to be done prior to the surgery and then things that need to be done after the surgery in succession so that we can get that full recovery. The main thing here, so we're going to skip shoulder impingement because adhesive capsulitis, so a lot of people get told they have a frozen shoulder. So frozen shoulder, the majority of the time, frozen shoulder is actually where it does not move. It totally gets stuck. And there's a lady named Dora Partridge that does research on this. Has a lot to do with women's hormones. So women actually get frozen shoulder more than men. Now, shoulder impingement is what we see as frozen shoulder just gets misdiagnosed as adhesive capsulitis. You can do something about shoulder impingement. Adhesive capsulitis has a lot of limitations with it. Now, rotator cuff tears, everybody has a rotator cuff problem, right? So we're going to talk about why that is because it's really important. And then it all comes from this scapular dyskinesia. That's not something that, has anybody heard of that term? That's not a normal term, right? Because that's on the physical therapy side of how do we get the shoulder blade to support the rotator cuff. And then so scapulothoracic joint dysfunction, thoracic outlet syndrome, and radiculopathies. Anybody have any nerve pain going down into their hand? Have you all ever had those problems before? Yeah, so that's compression, and we'll talk about it's double crush. So where if you take a water hose and you crimp it off higher up, then you'll still have a trickle of water coming out. But then if you go lower and you crimp it off again, you lose all that water. And that's what we deal with radiculopathies. We have one pinch point up the chain and we get a second pinch point, and our body does not tolerate that very well. So these three major causes, and this can go all over the body, but definitely with neck and shoulder pain. You can have an accident, car accident, take a fall, right? A trauma, but then prolonged position. So we can't control this. We can control what happens after it. So prolonged positions, prolonged postures, what muscles are we feeding, what positions, and then repeated movements and habits that we do, and how do we change those? We don't get rid of a habit, we have to replace it. So we have to find a better way to do things. Now, this is a cool slide. So just looking at, this is the rotator cuff right here, and this is the acromion. So that's the shoulder blade. So we end up with limits in range of motion, weakness, numbness, lack of sensation in those areas. We have very little space right there. So it really is dictated by this right here when we get overhead. So here's the dense anatomy portion of it. So there's just a couple really important. This is the rotator cuff muscle right here. So we have 4 of them. So teres minor right here, the infraspinatus, supraspinatus, and then the subscapularis. So it does internal and external rotation. Has anybody gone to rehab for their shoulder and they did a bunch of these? Right? That's what we always hover around. We're going to talk about that not being the best rehab approach. So, and it has to do with this shoulder blade and what this shoulder blade is doing. We have most range of motion in the body is from the shoulder, right? So we got the hip, it's also a ball and socket joint, but this one has the most range of motion because it's actually 2 joints. So the only bony attachment for the shoulder is right here on the front of the rib cage. Everything else just floats out here, right? And so the shoulder blade is actually the anchor for the glenohumeral joint right here. So the shoulder joint that we all have pain in has an anchor to it. And so go ahead and grab your side right here and feel that, and raise your arm up overhead right here, and you feel that wing, that bone coming out into you, right? So it's coming out to the side right there. Yeah, and so that's the shoulder blade. The shoulder blade has to move cohesively to increase space right here. So we can see this right here. We just have that little bit of space. If that shoulder blade doesn't move out, then we get that pinching right here. right? So we need this to come up and create space right here so it can come up all the way. And when we do that, we're attacking the shoulder blade and the rib cage. We're dancing around areas that are causing the area that is causing you pain. So we have to peel it back 1 or 2 layers every time we do rehab for this stuff. And we're going to talk about exactly what you need to be doing. This right here, so that's normal shoulder blade. That's what you guys were feeling, that bone right there. So it should make a lot of sense right there. And this is where the pinch happens. When we're doing this, we have the supraspinatus and the infraspinatus. Those are the ones that get torn the most. And so it's just because we're pinching on the shoulder blade bone. So everything that we're going to do is going to be focused around the shoulder blade and creating space for this joint. And then your body's able to get rid of the inflammation. If you found that video helpful, you can check out another video right here on if you're feeling weak after 50, we want to make sure that you're staying in great shape. But then also our entire presentation is right here on the page.